So have you ever had any missing sections of vision or flashes of light or new floaters or anything weird that's kind of gone on in the peripheral section of your vision or even central vision for that matter? We're going to be talking about retinal detachments today, retinal holes, retinal tears, and what that looks like for your vision and what it could mean. So what is a retinal detachment? A retinal detachment is what happens whenever a section or multiple sections of your retina, the delicate neurosensory tissue in the back of your eyes that transmits vision to your brain, whenever it separates from the eyeball and becomes kind of loose floating and kind of messes some stuff up in your vision. It can happen for a number of reasons. Diabetes, blood pressure issues. It can also happen due to acute issues like a car accident or other issues that we don't even really know at this point. Sometimes retinal detachments can occur spontaneously for reasons we don't understand ultimately. But either way, whenever it does occur, you could experience any of the following symptoms. You could experience a loss of vision or like a curtain veil, like black or gray or white, or a balloon or something that's kind of waving in your vision in the periphery or in your central vision for that matter, that kind of blocks and fuzzes and distorts your vision, or there's just kind of some missing vision in general. You can also experience a flash of light. So sometimes the vitreous humor can kind of pull up on that retina, triggering some neurosensory photoreceptor responses that send light signals to the brain. Because when that vitreous humor jelly kind of lifts up on that retina, that can send light signal pulsations to the brain. You can also experience new floaters, and we're not talking about just like maybe a few floaters. We're talking like armies of floaters, like tens, hundreds, maybe even thousands. It's just kind of like swarms of gnats that are moving into your vision because maybe there's a tear or a hole that opened up and blood's starting to leak into the retina. And you may not actually be seeing floaters. You could actually just be seeing some red blood cells moving into the vision that you are normally not used to seeing. That shouldn't be there. And sometimes that vitreous humor can rip open a hole as it separates in a posterior vitreous detachment. It could rip open a hole in the retina if that vitreous humor separates too hard, or it can create a retinal tear, or it can do any number of things like that. You know what a retinal detachment is like. You know what you can see, and you know what you can experience. So what do you do about it, and what's the timeline of expectation? Well, there's usually a couple of ways this goes down. So we're going to talk about the importance of what we refer to of a macula on and a macula off retinal detachment. So macula on. It means that your central vision, the macula, this is where macular degeneration occurs at, is still intact, and the retinal detachment has not lifted the macula up to cause any central vision loss, meaning that you can actually see centrally okay. There's just a weird peripheral issue. There is such extreme time sensitivity behind that because eventually the retinal detachment may go to pop off that macula. But while the macula is still intact, you'll want to get in touch with your eye care professional as soon as possible, or if you experience any weird visual symptoms, because they may need to refer you to the retina specialist that very same day in order to do some type of surgery, whether it's laser, air bubble, scleral buckle, anything like that. There's supreme importance on being able to be seen as soon as possible to save that central vision. So that's what we call like a macula on retinal detachment. Let's talk about a macula off retinal detachment. A macula off retinal detachment means that the retinal detachment has caused the macula to lift up and pop off of the retina where it is actually distorting your central vision. With that said, you'll still need to get in touch with your eye care professional as soon as possible so that they can refer you to the retina specialist. It just may not be that very same day. It could be maybe within a few days or a week or so, just because the macula is already lifted off and there's nothing really super emergent or urgent to save the vision at this point. Yes, the vision will be restored and it can go back. It just may not be what it was before the macula popped off because there's a ton of photoreceptors packed into that macula. And sometimes if it's ripped off, it's like scar tissue kind of building back over the central portion of your vision. It just may not look the same afterwards. But either way, the vision does get better once that macula goes back on. It just may not be the same as what it was before the retinal detachment occurred. So macula on, macula off, either way, whatever you experience with your vision, any of the symptoms that we talked about earlier, make sure that you get in touch with your eye care professional in order to get the best assessment, the best plan of action, referral process going, whatever it may look like for you. And you heard me mention a few And you heard me a few minutes ago mention what we call a retina specialist. What is a retina specialist? A retina specialist is an ophthalmologist that has gone on to receive additional training, education, and experience in order to delicately manipulate and surgically fix and heal the retina. These are highly specialized surgeons that do excellent work in being able to get that retina to lay back down or seal up any holes, gaps, tears, patches, anything like that. They do very well at that, and that's the kind of healthcare professional you would need to see in order to have the retina fixed specifically. Usually your local eye care professional or optometrist or local ophthalmologist will have a good connection with a retina specialist and can get you connected and plugged in with them and their office in order to be seen and evaluated. But you may already have an existing relationship with a retina specialist. And in that case, that's who you want to see ultimately no matter what. But if you don't have that connection, you want to reach out to your optometrist or ophthalmologist to make that connection in order to get that process going to have you be seen by that specialist. And there's different things that can happen with retinal detachments, whether blood leaks into the retina or there's sections of vision, like kind of a hole pops off. But the treatments that can be done with retinal detachments include injecting like an air bubble or a gas bubble. They can also do some lasers, like if it's on kind of in the far periphery, and if it's a small hole, they just kind of spot weld a laser around it to make sure it doesn't lift up anymore. They also can do what's called a scleral buckle. It's like just putting a buckle on the outside of the retina to make sure things don't lift off any further and then it goes back down. There's a whole bunch of things that the specialists can do, and they're the ones that make the call as far as what happens and what goes down. These are just some of the more common things I tend to see a lot of times when I refer patients to retina specialists for emergent retinal issues that need to be seen and taken care of, as well as the treatment of the eye needs to be seen with the professional wisdom of a retina specialist. And that's what happens in a retinal detachment. That's a retinal detachment. And those are some signs and symptoms you're going to want to be on the lookout for if and when you feel like a retinal detachment can strike, because it can happen to anybody, but you don't need to live in fear by it. These are just some things that you need to be aware of if you notice some strange or unusual abnormalities with your vision that you'll want to let your local eye care professional know about. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications. I'm Dr. Bryce Heffington. We'll see you next time.